Southwest Michigan Perinatal Quality Collaborative, or SWMPQIC, is a hub bridging community members, organizations, state-level initiatives, and birthing hospitals together. We work collaboratively to address disparities in birth outcomes throughout the region.
I have a lot of gratitude for the classes. A lot of the people in the classes with me, they were first-time parents too. So like hearing them ask questions about things that sound silly to us because we feel like we should know, it kind of made me feel like I'm not alone. Like it's okay to not know everything. So I feel knowledgeable and less scared. They definitely made me feel comfortable in advocating for not only myself, but also my baby and the care that we're getting.
We create space that offers everyone the chance to share their voice, their work, and their expertise. By offering listening sessions and town halls, everyone has the chance to say how maternal and infant health care can be improved.
SWMPQIC isn't empowering anybody, so you're already empowered as a human being. We're just teaching you the system, just teaching you how to advocate for yourself. We're all very resilient, and we all have our own power. SWMPQIC is just here to walk alongside you.
When I first gave birth, I was 18 years old. I was really scared. I just felt like I wasn't being heard. I was pressured into making a lot of decisions. Overall, it was just a scary experience. I feel like a big part of advocating for yourself is educating yourself, and taking these classes kind of pushed me to learn more about, everything that could happen and the birth process so that I could empower myself to make the choices that I wanted with this birth.
So a large part of our work is uplifting our partner organizations. So that way, all of the institutions, all of the organizations that are working in our region know what it is that our families are looking for and how to connect all of our community partners, our regional birthing hospitals, our communities, and our individual families.
Black and brown babies are dying at disproportionate rates, 4 times the rate in which white babies are dying. And so we want to educate families so that they know how to keep their babies safe, so that they do reach their first birthday.
We've had grant funding that we've been able to provide some of our partners to expand their work. We also provide training to healthcare professionals to expand their approach and understanding to perinatal mental health.
1 in 5 women or birthing persons will struggle with a perinatal mental health disorder, and 1 in 3 when it comes to our women or birthing persons of color. It's really important for us at SWMPQIC to make perinatal mental health a priority because we know it's the #1 complication of pregnancy.
This is a common thing that people experience, unfortunately, but there's community resources, there's people there for you that can be supportive and help you through that.
I stay involved with SWMPQIC because when I had just had my baby, postpartum was really hard. I attended a meeting and somebody had said something about an initiative that the hospital was going to do. And somebody said, wait, let's stop. Let's think about this from a birthing person's point of view. And I thought, here is a group of people who genuinely care about birthing people. And that was like the light switch for me. They actually genuinely care, and they care about initiatives that make sense. We value every voice, every experience.
So as a mother myself, I remember how incredibly overwhelming and daunting it can be to navigate all of the changes that are happening and all of the things that you need at that time as your family life starts to change. So as a physician, seeing what our infant mortality rates and disparities are, our maternal morbidities, and seeing organizations that are actively working together towards bettering the health of our community is so imperative. And that's why this work continues to be so important.